London, Reuters, a mass rapid testing scheme reduced COVID-19 cases in the English city of Liverpool by more than a fifth, researchers said on Wednesday, arguing it was an effective public health intervention despite concerns over accuracy of the devices. The community testing pilot scheme launched in November and offered everyone in the city tests whether or not they had symptoms, in an attempt to find a new way to use testing to limit the spread of the coronavirus. The study, led by the University of Liverpool with government backing, concluded that community testing led to an 18% increase in case detection and a 21% reduction in cases compared with other areas up to mid-December. The spread of the Alpha variant first identified in Kent made comparisons between areas more difficult after that point, the researchers said. The Liverpool pilot showed that community testing can work, and it works well if it is nationally flexible and locally grounded, Ian Buchan, the University of Liverpool professor leading the trial, told reporters. Tucker. People continue to ignore the science. Dr. Siegel. Evidence points to Wuhan lab as origin of COVID-19. Tucker. Scientists are pushing human engineering. Rubio. For all we know, the next great pandemic is being developed in a Chinese lab right now. Greg Olson's son TJ rings bell after successful heart transplant surgery. Fauci is a Democratic activist, not a neutral public health expert. Tom Cotton. Fauci had to know about COVID in 2019, failed to help close US border. Chang. CDC delays meeting due to risk of inflammation of heart in young people from COVID-19 vaccine. Family fighting to adopt faces roadblocks due to COVID-19. We jumped through all the hoops. NFL players blast league's new COVID-19 protocols. Airline mask mandates face bipartisan pushback. Harvard, Stanford doctors say mandating the coronavirus vaccine unethical. Clay Travis. Tennessee Rhodes College charging unvaccinated students $1,500 fee is absurd. Robert Redfield interviewed by Dr. Mark Siegel in Fox News exclusive. Dr. Siegel holds exclusive interview with Dr. Robert Redfield, former CDC director. Scientific community acted to squelch Wuhan lab leak theory. Some scientists have questioned the use of rapid lateral flow tests, saying they might do more harm than good, and the US regulator has warned that the performance of the Innova test in use in Britain has not been adequately established. Despite concerns about the lower accuracy of lateral flow tests compared to PCR tests, the Liverpool researchers said that the devices identified most cases with a high viral load. The rapid turnaround times had a benefit too, as lateral flow tests give a result in 30 minutes, rather than needing to be processed in a laboratory. If it's positive, people get immediate reinforcement that they need to take action. We can see it drove down cases, said Callum Semple, professor of outbreak medicine, University of Liverpool. As part of the study, 283,338 Liverpool residents took a test using a lateral flow device between November 6, 2020 and April 30, 2021. Reporting by Alistair Smart.